Do you offer porcelain veneers as a treatment option to your patients? If you do, I'd like to share with you a little clip, video from a webinar that I'm hosting, and this video will share with you the mock-up based stent preparation. And I'm Dr. Phelan. I've been treating veneer cases for the last 30 years in my clinical practice, and I've been teaching porcelain veneers for over 15 years to dentists all over the world, especially in an online forum. So I have a free webinar for you. It's called 5 Keys to Success and Longevity of Porcelain Veneers. And here's a sample. So stent-based preparation, I have a new video here of a recent veneer that shows all the different stents that we use in nice detail. So there's my cord. I pack the first cord and now I finalize the margin. So here I'm just finalizing this margin. I usually finalize it with lower RPMs and very little water. So you can see there's a lot of debris now. We're going to rinse that. But we also use a product called Detail to remove all the little bits of grinding debris. It's an EDTA solution from Clinician's Choice. Here's the Detail. This will clean everything really well for the final impression, whether it be digital or analog. Doesn't really matter. All the other steps are the same. So now I can get a good look at my margin, and it looks pretty good. And you can see this is the type of margin that I'm doing on a lot of my veneer cases. You know, it's a very light chamfer. And when you keep it this light, this is entirely an enamel. If you make it deeper, you're going to expose a lot of dentin. So that's pretty light. And here's the number 0 Ultra Pack cord. So I always pack a second cord. I don't think it matters whether you're doing analog or digital impressions. You should have good retraction. So here's the cord. And what I'm doing with the second cord is I'm trying to horizontally displace the tissue so we can see the margin well. The first cord gives me a good outline of the prep. The second cord horizontally displaces the tissue. And then I do a final check with the vertically sectioned putty. And all of these putties and guides and things are made from the diagnostic wax up. So that's a small sample from stent-based preparations. And if you'd like to see this and 6 other videos that I filmed for this free webinar, click the link associated with this video, register for the webinar, and we'll connect with you there. Thank you.